All right, let's go ahead today and talk about some barriers on devices and one-time use tips on products that we're using during our procedures. So as you can see here, we have a few examples. Let's start with the curing light. So with the curing light, we have on our plastic barrier sleeve. If you're not using a plastic barrier sleeve, then you have a very high potential that you're getting cured composite on your lens of your curing light. And as we all know, that if we get cured composite on the lens of our curing light, that has to be removed. And every time you're taking, whether it's more than likely some sort of metal instrumentation, then you're scratching that lens. So we're decreasing the quality of the lens and the penetration of the light to cure our composite because we're not properly taking care of this lens. So this barrier is a great device to use. With that said, if we're using the barrier, then this barrier is not to be wiped with a cavi wipe. This is a one-time use barrier that we're using for the patient that is on our schedule for this procedure. And then after this procedure is over, then we're changing this barrier to go on to our next patient with a new barrier. So you want to keep the lens of that curing light working clean and well, so it's giving you the quality penetration to cure our composite. Next example that we have is a Viva Bond pen. If you're not aware, this is a great bond product, but it also comes with a one-time use tip. When you order your pens, typically it comes with a bag of disposable tips for changing as well. So this is a one-time tip. So if this was used on your patient, then you need to change this tip and put on a new tip for your next patient. We are not, yet again, to be using the same tip on the patient, on multiple patients throughout the day. As a dental assistant and as a dental staff, that we are doing our best to eliminate or extremely minimize any cross-contamination from one patient to the next of any sort of potential disease. So changing that tip is something that would put that patient at a risk. The third item I have is etchant. So as we can see in the tip that this etchant was used, because I can see the blue gel within the tip. Yet again, I'm going to go ahead and change that tip so my next patient has a clean tip. And as we can see, there's no gel inside of this tip. Another thing that happens if you're using the same tip over and over, the gel that has the tip that has the gel in it, it sort of crystallizes and clogs the metal inside. So when your doctor or who's ever doing the etchant would go to push the syringe, that then this metal tip gets clogged, and then there's a good chance that you're going to pop off this whole piece of plastic. So changing that tip yet again every time. We have our flowable composite. The flowable composite tip also is something that needs to be changed every patient as well. So the composite tip as well, when you order your flowable syringes as well, there's going to be a bag of replaceable tips. So a lot of your products are coming with the replaceable tips that you need to change those after each patient. There's absolutely no reason not to be changing those tips. And then we have our compule of composite. These are also a one-time use on each patient. As we know that there's a cost involved, that if we're not using this whole compule of composite, that a lot of us and a lot of our doctors want for us to continue to use this compule until it's empty due to cost, which is understandable. So what was one of those options you can do, so this compule is not in the patient's mouth, is you can go ahead and use a mixing pad. So you could disperse some of your composite on your mixing pad, and then your doctor could take your heavy body composite that is on the pad and use it in the patient's mouth. When this compule is used in the patient's mouth, when you're dispensing that, and we're putting a little bit of pressure to kind of release that extra amount on the edge, this amount of composite that is on the edge of this compule tip was in the patient's mouth and on the patient's tooth of the prep of the filling that's being done. So if we do not If we would go to, again, reuse this on the next patient, then any bacteria that would be on this compule tip from our current patient would be transferred to our next patient. So this is a great alternative to making sure that we're utilizing the full amount of composite that's in that compule. Remember, change your tips every patient, and also anything that you're barriering, and those barrier wraps are not to be wiped with a cavi wipe, that they are to be replaced after each and every patient to help eliminate that cross-contamination. I hope this video helps with some explanation. If you have any questions, let us know. Thank you for watching. Continue to watch our other educational videos, and please let us know if there's any specific topic that you need help in, that we can go ahead and create that video to help you explain and help your day-to-day task as a dental assistant run smoothly.